This video is made to ensure a safe environment for patients and families fighting and preventing infections.
I was asked to talk about the importance of preventing infection when one has a family member receiving chemotherapy treatments. For me, it was my son Alexis who received treatments from the age of 2.5 to 3 years of age. This is what I practiced in my home for the first 7-10 days following chemotherapy. Before he went to the hospital for treatments, I would wash all of his toys and also all the door handles. I explained to Alexis the importance of hand washing as well as a 2-year-old could understand. Any visitors coming to the house had to wash hands before coming in, and if they had a cold, they did not come in, or they came at a later time. I placed a sign at the door so message was clear. I avoided doing grocery shopping with him to reduce risk of contacting any infections. We often stayed home and worked quiet to help him and his body fight the cancer with chemotherapy and minimizing risk of infections. Slowly after dangerous time post-chemo was over, we started going out in public but kept same precautions. Going back to a normal life was important for all of us. Alexis went through his treatments without having any infections at all. If we came to the hospital visits, we put a mask on in prevention. Managing precaution at home was very stressful but necessary. Washing all fruit and vegetables had to be washed carefully. Water from water bottles and not from faucets. Also to wash off TV converters and computer keyboard was a daily routine, and I continue to do this as it is now a regular habit in preventing potential infections. The best advice I can pass on is not to be scared that he will develop an infection if you practice even basic hand washing. For myself and my son and people close to us, that worked very well. To practice this in everyday life goes without saying. We practiced this more frequently when Alexis was sick as his immune system was fragile. He washed his hands routinely without asking, as this was a normal routine in his life. Hand washing is an essential precaution in fighting infections. As a regular practice upon arrival at our home, we would all wash our hands before preparing a meal, after touching an animal, and of course after going to the bathroom. You will be surprised how many people don't wash their hands. For sure, if Alexis had a temperature, I would have gone to emergency and also called IPO or nurse navigator for reassurance and for the guidance. Alexis' friends, my friends, grandparents all came, but we integrated the precautions necessary that helped normalize our lives and keep Alexis safe from infections.
Normally, our immune system is capable of fighting infections, but if your system is compromised, as it will be throughout receiving chemotherapy, precautions are necessary. This is a common side effect of chemotherapy, and our bodies are at risk of developing infections like a cold or gastro, urine infections, pneumonia, etc. Neutropenia is when your white cells that can help fight infection are very low and your body has difficulty fighting back. Practicing good hygiene is essential in protecting our bodies against sicknesses. Practicing good hand washing routinely is of utmost importance and should not be shy in implementing this in your home or with your visitors. Make sure you wash your hands for at least 15 seconds to make sure that you kill any surface bacteria on your hands. Make sure you rinse your hands very well and dry them carefully, as bacteria like any humidity. We recommend to have a bottle of liquid disinfectant at the entrance of your house. It's about 70% alcohol. Other examples are Purell, Sterigel, or an equivalent. It is also essential to bathe or shower every day in prevention of any bacteria in your body. and to use non-perfumed body lotion so that you can keep your skin nice and moist and not dry due to the chemotherapy. You must wear clean clothing every day and make sure that when it is washed there is non-perfumed detergent, as well as it can be an irritant to the skin. Proper mouth care like brushing your teeth every day and practicing good general oral hygiene. Please try and avoid putting your hands over your face, as your hands usually are really not the cleanest part of your body. Keeping countertops and any free surfaces clean at all times, especially your telephone or the keyboard of your computer. When using the individual disinfectants, please respect the drying time indicated on each individual bottle. If you have a superficial cut, please keep clean and cover with a dressing like a Band-Aid. If it becomes red or swollen or painful, please check with your doctor or call your nurse as soon as possible. Throughout your course of treatments, we recommend that you avoid public facilities like a swimming pool or a bowling alley, etc. Avoid cleaning cat litter and bird cages, and if you must, wear gloves and wash hands with soap, as good hand washing is essential in preventing infections. The first sign of an infection is a fever. Take oral temperature, and if temperature is 38 degrees Celsius for more than an hour, consult at the emergency department closest to you for an evaluation. Also avoid taking Tylenol or aspirin, as this may mask your fever. Other signs of infections are shivers, cough, nasal congestion, sore throat, or any other new symptoms that may begin. If you are receiving home care, advise your healthcare worker so she may wear a gown and mask to protect you as you are receiving chemotherapy treatments and your system is fragile. When should you wear a mask? All the time when you leave the house or go to a public place, especially following the treatments. This is when your immune system is fragile and are at risk to developing an infection. Your husband and children do not have to wear a mask unless they are sick, because they are part of your environment on a daily basis. Remember that if you have any visitors who have a cold, sore throat, or any other sicknesses, tell them to come at another time, as you cannot afford to be sick.